Hi, and welcome to the introduction video about health and social care. My name's Harriet and I teach on the course. So this is a BTEC extended certificate in health and social care, which means by the end of the 2 years you will get a BTEC, which is equivalent to 1 A-level. BTEC Health and Social Care is great for people that are interested in working in the health and social care sector. It will give you a really good overview of the whole sector, and the full 2-year course will enable you to progress to a degree programme from a range of programmes in the health and social care sector. The course is made up of 4 units, and as you can see, there are 2 in each year. So in the first year, we study human lifespan development, which is an examined unit. And we also do a coursework unit called Meeting Individual Care and Support Needs. I'll go into detail about these units in the next slide. In year 2, you also do 2 other units. One is called Working in Health and Social Care, and that's an examined unit. And then unit 14 is Physiological Disorders and Their Care, and that is your coursework unit. As you can see, they're not all equally weighted, and it's important to note that Unit 2 is quite heavily weighted. So now I'm going to explain a bit about what to expect in each unit. So Unit 1 is all about development through the life stages. So we'll look at all 6 life stages, which you can see on screen here, and we'll look at how a person develops during that life stage. We'll look at development in terms of physical, intellectual, emotional, and social development, and how different factors can affect how the individual develops. This course overlaps quite well with psychology because during it we'll learn about some psychological theories. For example, in infancy we'll learn about John Bowlby and Mary Ainsworth and their research into attachment theory. They found that infants attach to their primary caregivers not only for food and water, but also to feel safe and secure. You'll learn how these attachments and different types of attachments that can form can affect a person in their future and in the future relationships that they make. And you'll learn about lots of other different theories about how people grow and develop, and you'll apply them to different scenarios. At the end of the year, you'll have a Unit 1 exam, which is 1.5 hours long, and you'll be tested on the human lifespan and development. Also, in the first year, you'll do your coursework unit, which is Unit 5, and you'll learn about the principles and practicalities of the care disciplines. You'll learn about values and skills that you would need for a career in health and social care. You'll learn about all the different ethical issues which may arise, and you'll have to reflect on all the different methods that professionals can use in a multi-agency team to support an individual's needs. An example of what you'll have to do in Unit 5 is you'll be given scenarios. So for example, here we've got Valerie B. Now this is a made-up scenario, but it could happen in a hospital. So Valerie is 24 years old and she was admitted to the community hospital because her appendix burst before she could reach hospital. She has mental health problems which began when her parents died when she was 6 years old. Her surgery was complicated due to her being obese, and she has low self-esteem and can't see why she needs to lose weight or change her lifestyle. So you'll be looking into what support and care is available for Valerie, how a multidisciplinary team can work together to best support her, any ethical issues that might arise with this support, and how teams will have to manage confidentiality. Your answers to these scenarios will form part of your assignment for Unit 5. And then in the second year, you've got those other 2 units. Unit 2 is about working in health and social care, and you'll look at the legislation and the different professional roles and responsibilities that are required in the health and social care sector. And you'll be examined on that at the end of the second year. And you'll also study Unit 14, which is the coursework unit, where you'll look at different physiological disorders. You'll look at the signs and symptoms and causes of the disorders and how best they are treated. Common questions that we get asked in health and social care is whether you have to have studied anything health and social care related before. And you don't need to have done any kind of GCSEs in health and social care. Some examples of potential careers this could lead to. This is not an exhaustive list. The health and social care industry is massive and there is a plethora of careers that you can go into. This is just a few. Obviously, health and social care is at the forefront of everyone's brains right now and is a very important sector in society. So hopefully that answers some of your questions about health and social care. I can answer more of them during the Going to Godalming virtual sessions on Microsoft Teams and look forward to meeting you there. Thanks for listening and take care.